maintenance staff, and drivers who continue to do their very best for our students. We deeply appreciate your efforts and your professionalism. I now call this meeting of the Wild Rose School Division Board of Trustees to order. I would like to begin by acknowledging that we are on traditional lands, referred to as Treaty 6 territory, and that our students, staff, schools, and communities are beneficiaries of this peace and friendship treaty. The Board of Trustees of Wild Rose School Division is dedicated to ensuring that the spirit of Treaty 6 is honored and respected. It is the responsibility of the Board of Trustees to provide visionary leadership in the provision of educational services in keeping with the expectations of the community. This objective is best achieved when there is a clear and coherent statement of foundation principles to inform our decisions and the operations of our division. Within our foundational statements, we have three priorities: learning, leading, and well-being. Learning means creating powerful learning environments based on research and the teaching quality standard. A foundational focus on literacy and numeracy, providing individualized, timely, data-informed support for student needs, and support for the infusion of First Nation, Métis, and Inuit foundational knowledge into classroom instruction and school culture. Leading means that we empower students and staff to take on leadership roles, that we provide support for school leaders based on research and the leadership quality standard, and that we plan and support transition to post-secondary and the world of work. Well-being means that we promote student and staff wellness, that we develop a culture that respects diversity and belonging, and that we encourage healthy minds and healthy bodies. This is the first time the board has met since Premier Kenney addressed the province on October 4th, announcing and asking for measures in school jurisdictions. Tonight's agenda is the first opportunity this board has to explore together and respond to that call. We may not determine a response to the Government of Alberta's call tonight, but it will be a step towards that goal. The Government of Alberta's call and strong encouragement to introduce policies similar to those announced by the Premier for the public service are our single topic of discussion tonight. To establish a context within that we can talk within the converse within, I wish to read this correspondence that I've received from the Government of Alberta. Then we will hear the superintendent's briefing on a hazard assessment, and then proceed to a discussion in response. We may ask questions for clarification of the superintendent, and then talk about next steps. On September 15th, 2021, an order of council was signed stating that the Chief Medical Officer of Health has provided advice to the Lieutenant Governor and Council under Section 52(1) of the Public Health Act that a public health emergency exists due to the presence of a pandemic. The Chief Medical Officer of Health provided advice to the Minister of Health that COVID-19 presents a serious threat to public health, and therefore the Minister of Health has deemed COVID-19 to be a pandemic influenza. Under Section 52.81A of the Public Health Act, an order was made in respect of the pandemic influence has effect for 90 days, and that the Lieutenant Governor and Council is satisfied that as a result of the public health emergency exists, and prompt coordination of action or special regulation of persons or property is required in order to protect the public health. Therefore, the Lieutenant Governor and Council declares a state of public health emergency in Alberta due to a pandemic, COVID-19. On October 5th, 2021, the Officer of the Minister of Education and the Office of the Minister of Health sent out a joint letter to all school jurisdictions. It's titled, Encouraging Mandatory Proof of Vaccination Policies for Adults in Schools. It states, today, Alberta's government announced new measures to further protect students, staff, and communities, strengthening what already is in place as we face the challenges of this fourth wave of COVID-19. It is also clear that the best way to look after each other and to stop the spread of COVID-19 is for every eligible Albertan to get vaccinated. That's why today's announcement included a renewed call to school authorities as employers and operators of school facilities to develop policies that require proof of vaccination or a negative COVID-19 test for any adult who enters a school. This would include teachers, staff, and parents, but would exclude students. The school authority cannot deny their students access to education due to immunization status. Many employers and facility owners already require their employees to submit proof of vaccination or a negative PCR test. On September 30th, the Premier announced a new requirement for Alberta Public Service to submit proof of vaccination or provide a negative PCR or rapid testing result at their own cost. The Premier also encouraged all public employers, and specifically school authorities, to introduce similar policies. Today, we're reaching out to you directly to ask that you consider this request. Taking the steps necessary to have these measures in place as soon as possible would help all of us look out for our fellow Albertans and protect our province's healthcare system. Vaccines are among our best weapons to combat this pandemic, and the best way to protect children is to ensure the adults around them are vaccinated. During this critical time, we must do all we can to reinforce that message and to encourage as many Albertans as possible to get vaccinated. Thank you for your hard work and continued efforts to keep students and staff safe. Sincerely, the Education Minister and the Minister of Health. Another piece of correspondence received by me came from the Deputy Minister of Education. It was addressed to many groups of our education partners. It was written by the Deputy Minister, Andre Tremblay, and I received it on October 5th at about 9:30 p.m. Dear colleagues, thank you for your continued diligence in implementing public health measures and for your resilience as we adapt to the ever-changing COVID-19 pandemic. Today, the Premier, the Minister of Education, and the Minister of Health announced new actions to manage COVID-19 in schools. This includes, and they list off 5 bullet points of new measures. He ends with this. Finally, as this afternoon's announcement indicated, The Ministers of Education and Health have sent your boards a letter strongly encouraging all school authorities as employers and operators of school facilities to develop policies that require proof of vaccination or a negative COVID test for teachers, staff, and any adult who enters a school. Guidance documents are presently being developed and or updated to support these changes and will be provided once completed. In addition, operational calls with school authorities and stakeholders are scheduled for the morning of October 6th to discuss and provide further clarity on these changes. Thank you again for all your efforts to keep students and staff safe. Alberta Education will continue to engage with our education partners as circumstances change. Regards, Andre Tremblay, Deputy Minister of Education. That's the correspondence I received that directly relates to the Government of Alberta's call and strong encouragement for us to consider as additional measures in our school divisions. I now turn the floor over to Superintendent Brad Volkman, who will give us an explanation of a hazard assessment and the results, preliminary results of a early hazard assessment. Superintendent Volkman.
Yeah, thanks, Russ. I just also want to point out that we have with us this evening our Deputy Superintendent Greg Wedman, our Secretary, our Assistant Superintendent of Business and Finance, Emma Urbinsky, and also our Executive Assistant, Don Beeman. Thank you for their attendance. Yeah, so one of the first things that happened after this announcement is that the College of Alberta School Superintendents sent out to all superintendents information regarding a COVID-19 hazard assessment. And based on the legal advice they received, they said that school divisions should not be quick to adopt a policy without first doing a proper hazard assessment, and to make sure that their policies or procedures take into account their unique circumstances in that regard. So they sent us an outline of things to look at. One of the first things was, I think Russ already covered. The first element to look at in a hazard assessment is to look at any orders of the Chief Medical Officer of Health that might be applicable to the workplace. And Russ, I know you mentioned both the Health Minister, Minister of Health and Education Minister. You also mentioned a letter from the Deputy Minister of Education. But when it comes to our Chief Medical Officer of Health, where we find her statement is basically on the website, where you look at, they have a list of all the guidelines and protocols that we are to follow. And there's a section called vaccinations. And it does say we strongly encourage all school authorities to develop policies that require proof of vaccination or a negative COVID-19 test for teachers, staff, and anyone who enters a school. And they're very, also they note this does not include students. A school authority cannot deny students access to education due to immunization status. The next area to look at is try to get a sense of the active cases or symptomatic workers at the work site. And so we know that this year, unlike last year, at the start of this year, Alberta Health Services was not letting us know as school divisions when there were positive cases of COVID in our schools. So instead, what happened was parents and staff began to self-disclose. They would simply call us. They would call the school principal and say, my child has tested positive for COVID. And so we began to track those just internally for our own cases. We also then would ask that parent for permission to send a letter home to all the other kids in that class so that those parents could make intelligent choices or informed choices about whether or not they would send their child to school, knowing that there had been a positive case at the school. And so I can report that we have had from September 1st till October 12th, 213 self-disclosed cases. Now, we do want to interpret those with caution because we're not sure if they were infectious while at school. That's something Alberta Health Services used to do for us. They would tell us that, and they weren't telling us that. They weren't doing that work this time around. And in some cases, parents may have been using rapid tests, or in some cases, we even heard where a parent would say, well, my husband has COVID and one of our other children have COVID, and the younger one now is showing the same symptoms. We're not going to get them tested, but we're pretty sure that they also have COVID. So we do want to interpret these with caution, but also remember that not all parents would have disclosed to us, or they weren't required to. So we interpret it with caution, but we can safely say that there were quite a few. By way of contrast, last school year, when Alberta Health Services did contact us and did confirm every single case of COVID that was infectious while at school, for the whole school year, all 10 months, we had 66 cases. And so it does show that there was a fair bit of COVID happening in our communities compared to last year at this time. Student absences is another way for us to measure what's happening with our students in terms of their health. Of course, there's other reasons why students might miss school, but their health is often, one of the main reasons. And we've seen that we kind of started the school year with about, we have about 4,500 students in the division, and we had about 500 at the start of the year that were missing school, that they were absent in the whole division. And that reached a peak around the last week of September of 1,300. Right now, it's back down again. It's back down to about 625 was the last number I saw of student absences. That's per day in our school division. Also, what about staff absences? When we look at those, kind of a similar pattern. We started the year with anywhere from, and we have a little over 500 staff, but we had around maybe 16 or 17 absent early on when September started, and it reached a peak of about 55. That was around, again, mid to end of September. And we did go through a stage there where our principals were having difficulty finding substitute teachers. That was in the end of September. In fact, one school, West Central High School in Rocky Mountain House, we actually had to end up going to 2 weeks of online learning because we simply couldn't operate the school. We could not find enough staff. And you need to have enough staff to keep a safe environment and for the proper teaching to happen. And so, but again, we've seen that start to now go the other direction. We definitely aren't having that same issue. We're not hearing from our principals right now that they're having difficulties filling classes with teachers or getting the subs that they need. I guess the last piece is the government now, as of October 12th, has again started to do their contact tracing, and they've identified schools as either being at alert status or outbreak status. And currently we have 5 schools at alert status. And what that means is that there's 2 to 4 cases of positive cases of COVID in that school. So we have 5 schools in that category. They have a second alert status, which is 5 to 9 cases. And we have 4 schools with 5 to 9 cases. And outbreak status means 10 plus cases. We have 3 schools currently that have 10 or more cases of COVID cases in the last 2 weeks. And so that leaves 5 schools that have either 1 case of COVID or no cases of COVID at all. So that's kind of the way things look. Another way to look that we've been asked to look at in a hazard assessment is what are the number of active cases in your region, in the community. And so when you go online, we see that Brazeau County currently has 149 active cases. And that turns out to be 886 per 100,000. That's kind of a measure of of showing how we compare to other communities based on our population. Clearwater County around the Rocky Mountain House area has currently 243 active cases, which is 1,201 per 100,000. Just by way of contrast, in some of the urban centers like City of Red Deer, they have far more cases. They have 663, but as a percentage of per 100,000, it's only 623. And for example, the City of Edmonton has 2,111 active cases, but if you look at the per 100,000, it's 203. So it seems like the small rural communities, and I've looked at a lot of them, that's typical for all of Alberta. The smaller rural communities do tend to have less cases, than their urban counterparts, but they are greater in terms of the number per 100,000. Next is we've been asked to do a hazard assessment to try to find out, how many of our workers are vaccinated. Now, because this is personal medical information and we don't have an actual policy or procedure in place right now, we were encouraged to make this an anonymous survey. And so we've done that. So again, we need to interpret it with caution, these results. Not everybody was required, or not everyone filled the survey out. I suppose some may have filled it out twice. I'm not sure why they would, but that could have happened either accidentally or what have you. But here's the results. Out of a total of 694 staff, now that includes not just our contracted employees, but our substitute teachers, our casual EAs, our casual custodians. There's a total of 694. Grand total, 496 answered the survey. And 388 of those indicated that they are fully vaccinated. 89 indicated that they're not vaccinated at all. So based on that survey, and we know it's a rough estimate for the reasons I've given, approximately 78% of our staff appear to be double vaccinated. Another way to look is the Alberta government on their website shows vaccination rates for regions. So Drayton Valley, they list as being fully vaccinated for everyone 12 years and older, 12 years of age and older, 53.1% in Drayton Valley. And that includes the Brazeau County and surrounding area. Same thing, Rocky Mountain House, a little bit higher at 56% fully vaccinated. They also ask us to consider the presence of persons with health vulnerabilities. And so we don't know this information for our staff, once again, because we don't collect that medical information. But for our students, we are made aware. And so we know that we have 107 students total in the division that would have health vulnerabilities. 84 of those would be considered severe. So those are things like diagnoses of fetal alcohol spectrum, autism spectrum, diabetes, cerebral palsy, etc. So 84 that are severe. There's 12 that actually are considered to be complex, which means they have more than one of those. They have one or more. They have more than one severe diagnosis. So there's 12 like that, and then there's 11 students that are mild to moderate medical needs. But that's a total of 107, which would have greater risks related to COVID. Then the last piece is just kind of looking at what kind of activities take place in our organization. Well, we know that our activities are learning, and so we're talking classroom settings, hallways, buses, some offices for our staff. We were asked to look at what's the ability to be physically distant in your workplace, and we would have to say that it's not that easy. I would say in our classroom, students are definitely closer than 2 meters together, and on our buses as well, and in our hallways. So that's the first part of it. The next thing we want to look at is, well, what about our employee and public responses to all of this? So we reached out to each of our professional organizations, employee groups, professional organizations, or unions. And so we have 3. We have the Alberta Teachers Association Timberline Local, which is the teachers that work for Wildrose School Division. We have CAMC, that's the union that represents all of our support staff, secretaries, librarians, educational assistants. And then we have the IUOE group that represents all of our custodians and maintenance staff. And they all come out pretty much with statements that are very similar. And basically what they're indicating is that they, as a union, as a professional organization, support the idea of a vaccination policy for our school division, but based on a few things. And so they'll talk about, well, make sure it doesn't contradict or contravene the collective agreements that they have with us. Make sure it complies with human rights legislation, especially where there's a medical condition or some other protected grounds for people that can't get vaccinated. They also ask that we not impose disciplinary measures for non-compliance, but provide non-disciplinary alternatives. And they list those. Some of the alternatives they list would be the ongoing submission of negative COVID test results. They see that as a potential way of accommodating those that don't want to get a vaccine for various reasons, or can't get a vaccine for various reasons. They also list things like reassignment to online teaching or online assignments, if that's possible. Of course, we don't have an online program this year in Wild Rose as we did last year. We didn't have enough interest, so we really don't have positions like that. And then they do state leave of absence without pay as a last resort. So they kind of say, well, that would be a situation where an employee would not avail themselves of any of these possibilities that were made available to them. So that's kind of the sense of what they have sent to us regarding their feelings on this. So, but keep in mind, that is the views of the official organization. That's the views of the union or of the professional organization. And so we also put out a survey to our staff and to all staff and said, please feel free to share your feelings or your opinions. We ended up with 90 submissions as of today from staff. We also received, in addition to that, probably another 30 to 40 emails. Now, some did both. They did the survey and they did the emails, and they sent them directly to myself or to trustees. And we see a mix. We see some that are in favor, and we see some that are not in favor. I guess that's what we should have expected. But what we want to be clear on is it's not a vote. The board needs to make this decision based on, and this is the advice from legal advice, that the board needs to make this decision based on the hazard assessment that we were going through earlier, that we went through earlier. We've also received multiple emails from parents and the community who also have a vested interest in this decision of the board. It may seem like it impacts our staff mostly, but we've received, I'm sure we've received close to 100. And some have gone straight to board members, some straight to me, some to a mix. And with them, they have sent, in some cases, legal briefings or medical or scientific briefings that they have located, and they have sent those to the board and to myself. And I would say that the vast majority of these have stated that they're not in favor of the board creating a policy. We have to look at operational considerations. As I mentioned earlier, we went through a stage there in mid-September where we actually had to close the school or move to online because we could not find enough substitute teachers. And there were other schools that were telling us that they were close to having to do that. In some cases, for example, principals and vice principals who normally don't teach all day but have to have time to do the administrative work, they were actually having to put that aside and go in and cover classes. Teachers were, in many cases, when they would have their typical prep period to prepare for classes during the week and to mark assignments and so on, they were giving those up in order to cover classes of colleagues that were ill and were not able to be at school. So we know that our sub list, it can be tentative. Like we can be in situations where it's risky for us. And when we look at things like transportation, we probably don't need to look at that one as closely, because this is really about building a policy regarding who can work in our schools. And when it comes to transportation, we don't own the buses. That's all contracted out. They're not ours. The bus drivers are not our employees. And so it's not that the board couldn't work with our contracted transportation services to figure something out. But I'm seeing that in some cases, other school divisions that are looking at this they've kind of left transportation to the side. Some are also noticing that they're not including parents as part of the policy. So that is something that the board would have to make a choice if they were going this direction. Would they actually require parents who are entering the school to show proof of vaccination, much like when you try to go to a restaurant or to a hockey game or something like that. Again, I'm noticing that in a lot of cases, that's not happening. I shouldn't say a lot. We don't have a lot of policies to look at, but the few that we've looked at, we're not seeing necessarily that it's being applied to parents, especially when they're just dropping off. It wouldn't really make sense. A parent's just dropping off a lunch or is just picking up a student midway through the day, that may not be necessary. We have to look at contracted workers and volunteers as well. And so the board will need to consider all of those. But in terms of us being operational, I think our biggest risk is, having enough teachers and support staff and subs to continue working. Another piece we need to look at is practical considerations. Enforcement. How does that look? We know that when we're collecting a person's medical vaccination status, that has to be done very carefully. And so, I've looked into this a little bit, and probably the best way is it would be reported to one person in the division. And that would be in the human resources department, where that information would be stored. Also, what about those that either cannot or are unwilling to get vaccinated? Again, a lot of organizations are allowing their staff to show proof of a negative COVID test. How does that work? If the COVID test is administered at home through a rapid test, how is that then proof shown to the school? And we still are looking into that. I've got emails out to Alberta. I sent an email to Alberta Health Services. They kind of redirected me to someone else, and now that person redirected me to someone else. And so that's why this isn't a complete picture yet. Still working on some of the details, but that'll be important. How do we actually implement that part of it? And we're not even certain about the availability of rapid tests in particular areas and rural areas. Some of our staff live quite a ways away from pharmacies and so on. So something we need to kind of consider. And then there's the cost of the rapid test. We notice in a lot of cases, the cost is to be absorbed by the employee themselves. In some cases, we're hearing of school divisions that are planning to have the school division will cover the cost for the first couple of months. That gives staff time to go and get vaccinated, but they typically are talking about an end date, probably about 8 weeks or so, where they would then make it the responsibility of the staff member to pay for those tests. I know the board asked me, what are other school divisions doing? So there's 8 school divisions in Zone 4. Wild Rose is one of those. I've been in contact with those other 7 school divisions. Today, I was also in a meeting with some of our neighbors around the Drayton Valley area, like Black Gold School Division and Parkland School Division, Star Catholic. They're not in our zone, but they're neighbors. And I would say out of those 10 boards that I've spoken with and that as we've met, there's probably 2 that are close to presenting a policy to their board of trustees for consideration. They're not there yet, and they didn't really give me a date or a time when that was likely to happen. The other 8 seem to be taking it much slower, concerned a lot about staff morale and the potential impact on operations if they move too quickly. At the same time, I think we're all feeling the urgency that Russ mentioned was in the letter from the Minister of Education, that we need to consider this sooner than later. Something else, I haven't even had a chance to talk to Emma yet about this, but I heard today that there is some rumor of insurance ramifications. School divisions that don't have such a policy or procedure there may be some insurance ramifications. So again, we'll find that information out for the board for a future meeting. Legal considerations are a big one. A lot of the emails we received from parents really focused a lot on human rights. And so this is something that we've reached out to 2 very reputable law firms, Brown-Lee and McLennan and Ross. And Brown-Lee seems very confident that a vaccine policy would be upheld in terms of any kind of occupational health and safety grievance or complaint, or any kind of human rights complaint as well. McLennan and Ross, I would say they seem also fairly confident, but maybe not quite so much. And they seem to be urging just a little more caution. And but they admit that they've been creating these policies for other school divisions. They just really, they really are emphasizing, make sure you do your due diligence in looking at your own hazard assessment. I also just came across on the College of Alberta School Superintendent's website an opinion that was created for the Alberta Federation of Labor. And this is Alberta's largest worker group. They're called the Alberta Federation of Labor, and they've released a legal opinion stating in almost all cases, mandatory workplace COVID vaccination policies are legal and would not be overturned by arbitrators or the courts. And so then they quote some of the different legal firms that they've been working with. And so, of course, the board needs to consider what is the legal, liability of both sides, of either not creating a policy or of creating a policy. And in fact, Brown-Lee stated that they felt that we might be more at risk if we didn't create a policy due to someone getting COVID. That's where McLennan and Ross kind of disagreed. They said, it's unlikely that a board is able to guarantee to its employees or students that they'll never get COVID. And it's unlikely that they would suffer loss for not having a COVID policy. So we can see that even the legal firms don't necessarily agree. Where they do agree, though, is that in this case, is that it's something that school divisions are creating, and they're helping them with it, and they do see a path of doing that in a way that follows the law and it doesn't put the school division at risk. The last thing I'll just mention before I pass this back is, should this be a policy or administrative procedure? So the lawyer at Brown-Lee stated to me that most divisions are approaching this as an administrative procedure, which means it's in the superintendent's sandbox more than it is in the board sandbox. However, he stated it can easily be a policy. The board, I've learned this early on, the board can have whatever, the board can take on whatever they want. And so anything that they want to make a policy, it's theirs. If they want it to be an admin procedure, then it's for me to kind of work on. So what he stated was, he suggested that boards, if they want to go this direction, and I know this board hasn't made the decision yet, but if they make a decision that we need some kind of a policy or procedure, that the board would pass a motion if they felt they needed to do this, and the motion would direct the superintendent of schools to create an admin procedure. And the reason he's saying admin procedure makes the most sense is because occupational health and safety issues are actually delegated to the authority of the superintendent of schools. And of course, we know that the board's role is more governance, not so much administrative details. So that's up to the board. If the board, here's your choices. Nothing, you don't make a policy or administrative procedure. You choose to make a policy on this, or you choose to direct me to make an administrative procedure on this. But my understanding is that this evening, probably there is not a decision to be made. We do have at least 2 different delegations that would like to come and present information to the board, one in support of a policy, and one that is would urge you to not make such a policy. And we've let them know that there'll be a future meeting at which time they'll be able to make that presentation, but that we weren't quite ready for it this evening. We're just, like, as Russ said, this has been our initial, very first chance to discuss this as a board. So, questions from the board that I can try to answer.
Thank you, Brad. That was a lot of information, and I'm sure trustees have a lot of questions. I know I've been jotting down some, but I'll wait my turn. I see Mr. Scott, you have your hand up. Go ahead.
Yeah, I have a number of questions and I have some comments, but I'll just keep it to the questions. Brad, one of the ones you walked through is if a policy or a procedure, admin procedure or policy is made either way. I guess one of my struggles is, so we've got this document that says we're going to do this and this and this. I know like stores or whatever are putting people at the door to check for documents, and if you don't have them, you don't come in. So how are we as a school, when we short-staffed as it is, then I have somebody sit at the door to check documents to, because if you don't have somebody to police it, I guess in my humble opinion, don't put a document in place, because then people are just laughing at you. So what are we going to do to back this up?
Yeah, so that I did try to address that a little bit in the enforcement piece, and I don't know the answer yet. I've like I said, I've contacted Alberta Health Services. They've directed me to a different person. They got back to me today, and they've directed me to a third person who I'll try to connect with tomorrow. But you're right; it's something we need to consider. Is it enforceable without undue difficulties within our school division? So what I'm hearing is that you can do it at home, and that will be the difficulty if we allow it at home. I've heard of some school divisions that, one school division who, again, they haven't finalized anything, but they're thinking that they wouldn't allow the home test. They would require the employee to go to a pharmacy, because the pharmacy then could provide an official document.
No, that's not my question, Brad. I appreciate where you're coming from about the testing itself. I'm talking about entering the building. So a
Yeah.
parent comes by, they're volunteering for whatever in the building. Who's going to check them off that, oh, your documents are in, or produce your documents, you can't come in if you don't have. I'm talking about at the door, not the testing part.
Right. So they have this document. Who are they handing it to? That's what you're asking. Regardless of how they do it. Yeah. Good. Okay.
Yeah. Who checks it to make sure it's valid?
Yeah. Well, Daryl, I thought we might get you to maybe just go to some of those schools and you could do that for us.
Get right on it. I mean, that's one of my. I appreciate maybe a bit of a small point, Brad, but if you're not going to do some sort of check on this thing, then I guess don't make a policy and people just laugh at you because it's irrelevant, because it's just a piece of paper. It needs some oomph behind it.
I was in Canadian Tire the other day in Sylvan Lake, and someone walked in front of me without a mask, and you're right. Someone stopped them and said, "Oh, I'm sorry, we have masks over here. Can you please put one on?" And they did. So you're right. It would be probably our front office staff that would be responsible for collecting that information, and we'd probably have to put the signs up. Please treat our folks with respect. On these matters. They don't make the rules, but they do have to implement them.
And just so second part of this one. So you made the comment where you're talking about people coming in to pick up the kids or drop off a lunch for a kid they forgot, those kinds of things. But I guess my struggle with that is you use the words, they're just coming into the building, but they're just bringing COVID in the building. I mean, if you're a COVID person and you're touching stuff in the building, I mean, we've hired extra staff for cleaning to prevent that. I guess I struggle a bit with the comment of, I appreciate it's a struggle, but if we're going to make a rule, then even the parents just coming in to pick up a child, they're just bringing in COVID. I think we need to be very careful of that. And again, we're making this mountain much bigger than it should be, but that's almost where you got to go.
I mean, there's no question that the minister's joint letter does state all adults entering the building. Having said that, I'm just letting you know that there's some school divisions are deciding that it's not going to apply to parents, that it's going to be, unless a parent volunteers. If a parent is actually in a classroom volunteering, then it would apply to them. But otherwise, I'm seeing examples of that not applying to a drop off.
Yeah, they're just bringing COVID in. That's all.
Yeah.
Before I interrupt, are there any other trustees who would like to question Brad on the hazard assessment? I guess while you're thinking, I'll chime in and say one way we can find out if we go this way is how to make a policy operational, is to look at the experience of other divisions. We know that Edmonton Public, a larger division with many more resources than we have, announced their policy on October 4th, and presumably have been doing some of it, not all of it, but some of it for the last week or more. Are there any other questions from trustees? Daryl? Sorry, I'm seeing Julie. Julie's hands up.
And Heidi has her hand up.
Oh, I missed Heidi. Go ahead, Julie, and then Heidi.
Hi. I was just going to mention though, Russ, just regard to your comment there. When you look at a city, you know, Edmonton public is really big. That's an urban municipality. And I think that in the rural areas are going to be a little bit different than a
Yeah,
big.
you're right. The best examples would be our comparables.
Mm-hmm. Yeah.
I agree. Did you have a question, Julie, or? Okay. Heidi, then Daryl.
My question is just about the response we got from Brownlee. I thought that in that response, they stated that they had seen successful, just wait, let me find the wording here. I am aware of cases that failures to take sufficient COVID-19 safety measures have led to successful complaint to a labor relations board. And I didn't see anything the same about that in the letter from McClellan and Ross. Did they not agree on that, or did they not acknowledge that specifically?
Yeah, no, good point, Heidi. And certainly Brownlee said they weren't aware of any examples the other way where a school division makes a policy and that there were complaints. But I think partly that's because it's fairly new. McLennan and Ross, oh man, it's a long letter here, but they do talk about how it's not possible for a school board to anticipate or to be able to promise that no one will get COVID, no staff will ever get COVID by being at work there. And they do specifically state that for that reason, it's unlikely that, and lawyers love to use words like that, right? It's unlikely, it's not probable that there'd be a problem for a school division based on not having such a policy.
But it appears in the other letter just that the precedent had been set. Okay.
Yeah.
Just wanted to clarify.
McLennan Ross states that, for example, if a school board knew of a staff member that tested positive and allowed that staff member to go to work, then they would be liable. But that they would not be liable by not having a vaccination policy. No, they didn't say 100%. They said, unlikely that they would be liable.
A supplemental question, Heidi? Mr. Scott, floor is yours.
Yeah, Brad, the lawyer opinion, which is an opinion.
Yeah.
Every lawyer has an opinion, and every lawyer will tell you their opinion is correct. And that's why we have courts of law or arbitration through labor relations to work those things out. I guess, so with that in mind, I guess part of my concern is, I mean, we've talked about doing a board policy, and you've talked about some are doing the AP through the superintendent, because lawyers have different opinions on which side it should fall. I guess you can gather as many as you want for different opinions, but that's a struggle for me right now is as a board, do you look at a policy point of view, or do you look at a AP point of view? Because it falls on different categories, and this is a fairly significant issue. That's if you agree that you mandate in the first place. I mean, the Minister of Education through the school or through the act cannot mandate staff to do anything because she's not the employer. We are, but the health minister with a pandemic can order mandated materials, but they're choosing not to. They're still using language to us that they strongly recommend that we do this. And my struggle with this is through the health, they have the power to do it, but they're choosing not to. So I guess I want to keep my feet on both sides of the fence for a while here because I'm not sure which side to really fall. But I guess I'm looking at, I'm struggling to get information somewhere along the line is the power of a policy versus an AP if we do mandating which is a better way to go, because as you have said very clearly, this is going to involve a staff morale issue. I'm like probably most. I currently have 75 different emails in my inbox, a lot of parents and quite a bit of staff. So an issue that we believe, if we go through with it, that's going to cause a staff morale problem, why would we put that in your hands? Because you're the ones going to have to deal with the staff morale problem. If we believe strongly that we're going to do this thing and there's going to be an issue within the staff, then why isn't that going to be a board policy? And Mr. Volkman and superintendent's team work through the morale issue, because if Mr. Volkman and his team have done the AP, they're not the ones to resolve the morale issue because they're causing it. Do you kind of understand where I'm coming from, or am I making any kind of sense to you?
Sure. Just I guess all school divisions have their own governance model, and several of us out there have this model where there's policies and there's admin procedures. There's some school divisions where it's just all policies, and it's not delineated this way. In terms of practical application, it won't matter whether it's a policy or admin procedure. If it is created, it'll be in force, and it'll have ramifications for our staff. I suppose the path for getting there might look a little different. We've got board policy 10 that describes how policies are made, and I have an admin procedure that talks about how admin procedures are created. But at the end of the day, if the board passes a motion directing me to create an admin procedure, it's probably not a whole lot different than the board voting to create a policy. Either way, the board's taking responsibility, and leadership on this important topic.
Thanks.
I had a question, but I'll cede my time to Heidi and then Julie.
Just one thing that I think is worth mentioning is that if we implemented a vaccine mandate, there would be a morale issue, but if we don't, we may also have a morale issue on our hands. So it's something that we need to consider, is that there are people who will be upset on both sides, not just one.
Absolutely. That's a very good point, Heidi. We've seen from the survey results, the 90 responses, that there were many that encouraged the board to create such a policy. And so you're absolutely correct. It's just one of those issues that no matter which way the board goes, there'll be some that will not be pleased. But that's where I want to continue to encourage us to look for ways to be as accommodating as possible, to be as understanding as possible. I've always said, and I'll continue to maintain, there are very reasonable and good and excellent people on both sides of this issue. I think we all know that. If you're like me, you've got family members that you love and care for that are on either side of this issue. If you happen to be someone that has a service club you attend or a church you attend, you've seen how this is just split all the way down in our communities and wherever. And there's good, reasonable people that have very important reasons of why they believe what they believe. And the tough part is now our board, we need to make a decision, but whatever that is, we have to look for ways to be as accommodating and understanding and as gracious as possible. However, that's not your first and primary important task. The first and most important one is the safety of all the students and staff in the school division. And I know that's something else that our board has done for throughout the whole pandemic. And Daryl, you touched on this, and it's not quite as simple as maybe as I thought. Just the way you worded that, it made me think a little bit more. But we've always said there are so many voices coming at us, so many experts. If you look at the emails you're getting, you'll get a legal opinion that actually says, whoa, you're going to get sued if you make this decision. And then you get another legal opinion that says, no, all the evidence seems to show that you won't be. You've got the medical science, some saying, oh, this is the most safest and best way for us to get past and get COVID out of our communities, and others that say, whoa, this is experimental and so on. So what does the board do? I saw one email tonight that said, which of you are experts? So they listed all these areas. And I actually, I didn't respond, but I just said to myself, yeah, none of us are. So what do we do? Well, we've always said that then I guess we will listen to those that are, because we have to make a decision. A non-decision, that's not what boards do. Your role as governance is to make these decisions. And so who should you listen to? Well, I suppose you should listen to the experts. Well, yeah, but we've been told there's so many experts. So which expert? Well, where you've been consistent since the beginning of this whole pandemic is you've listened to the advice of the Chief Medical Officer of Health of Alberta and Alberta Health Services. You've decided that we have to choose somebody to listen to. We aren't the experts. We can't interpret all those legal documents. We can't interpret all that medical and scientific documents, but there are those that have been placed in authority over us in this province that's what they do. But I'm going to muddy the waters a little bit when Daryl said, but then why haven't they mandated it? Why have they downloaded it to us as school divisions? So they strongly urge us, but they just come short of mandating it. And that's, I think, the conundrum that our board is in right now. We've always tried to follow. Hey, when they said that we had to put masks on all of our staff and students, we did it. And we heard from the side that said this is not good. Then when Alberta Health Services and the Chief Medical Officer started this school year and they said, yeah, guess what? You don't have to wear masks this year. We did that. And we followed it all. And then we heard from the other side. And so this has been the back and forth a little bit. But we need to choose somebody to trust. We need to choose somebody to listen to.
Thank you, Brad. I see Julie has a question, and then Daryl, and then it's my turn.
Okay, I just wanted to add a little bit with regard, when we talk about staff morale too, the one thing that I have, been a little bit concerned about is staff retention. That goes along with staff morale. And no matter which way we go, that's going to be another area too. Are we going to start losing staff? So, that's another thing that we have to take into consideration as well.
Yep.
That's just a statement, Russ. It's not really a question, because I don't really know how. Yeah, I just don't know how you would deal with a situation like that if you don't have enough, subs to cover. That's another area that has to be explored too.
Yeah, I'm just blue skying this out there, but an answer to your question might be we look at vaccination rates among teachers and the growth in that. What else could we look at to anticipate whether we lose staff or not? Maybe we could look at comparable jurisdictions who have implemented a proof of vaccination mandate, or through CAS or the ASBA share some data on that to give us an idea of what's at risk, what's at stake. Certainly, with the lower vaccination rates in our two jurisdictions, Drayton Valley and Rocky Mountain House, we might be led to believe that if there's less people vaccinated on average, that there's probably less teachers vaccinated on average. I don't know if that would be a predictor of retention or not. But I think our first step would be look at the data with caution, look at comparables, and then look at non-comparables and see what their experience is. But again, I'm just
I don't know.
Not the expert. Mr.
No.
Scott?
I've had a couple questions. May put her hand up. Let her go.
Oh, I'm sorry. Go ahead, May.
I agree with Julie where she says that I kind of think we might lose some staff, but also in some of my emails that I got from parents, that if the vaccinations were to be put in place, that they would pull their kids out of the schools. So that's another thing that could be. And then they want to come get enough money to from the school, because we have the money as at end of September, and they want to come and try and say they need the money because you're not educating our kids.
Mhm.
Did you have a question on top of that, May?
There's been lots of good conversation, and I think Brad's did a lot of work for us. And I think we still need to be a little cautious and just get some more answers, and then we're going to have to make a decision.
Thank you, May. Go ahead, Daryl.
Yeah, Brad, your comment, Brad, your comment when we talked about, you identified to do a risk assessment, which is a workplace or a hazard in a workplace, which we're going through. I understand that. I have no problem with that. But I guess my struggle with this is our workplace includes more than just our staff. Unfortunately, or fortunately, whatever way you look at it, our students can't be asked or questioned under the Education Act. Unfortunately, though, I'll take Frank Mag High School. Every student in that school is old enough to be vaccinated. Yet we're going to mandate staff to be in a building with people who are not vaccinated, who we cannot mandate. And so I guess as a worksite hazard assessment, how do you get around that issue for an assessment issue?
Yeah, so the hazard assessment that they gave us did not include trying to figure out, how many students are vaccinated. But having said that, this is probably a generic kind of assessment that is meant for all businesses and organizations. So, you raise a good point. We know that there'll be a certain percentage of students, and I guess the best way to do that is we could go to that site that shows the 12 to 18-year-old, percentages in our communities, and that could give us a sense of how many we have that are vaccinated.
But my understanding is, correct me if I'm wrong here, Brad, but my understanding is because it's a student, we're not allowed to ask that question.
No, but we can get an estimate based on the Alberta Education website, because they'll tell us how many from 12 to 18 years old in Rocky Mountain House, for example, in that area, which includes Clearwater County. And it'll be the same for Drayton Valley, so it gives us a bit of a sense. But yeah, that would be the best we could do to add to our hazard assessment.
Daryl, I can tell you that right now. Rocky Mountain House, 12 to 19-year-olds, fully vaccinated are 38%.
Yeah.
Drayton Valley in an area, 12 to 19, 36.2%.
I mean, so I'm back to the same question with Brad. As a workplace hazard assessment, if you're doing a full hazard assessment of a workplace, that needs to be part of that assessment.
So
you can't control them. Don't get me wrong. You can't control the kids, but that needs to be part of the assessment process.
So are you saying that those numbers that Russ just mentioned would put our school division at a higher risk than, say, at a school division where the community's 12 to 19-year-olds are 70%, for example?
To me, I can't help it. I mean, again, the same thing, Brad. It's a risk assessment. So we have to make sure we identify all the risks. Now, can we mitigate the risk? Can we work around the risks? I mean, there may be solutions to it, but if we're doing a full risk assessment, those students are part of that risk assessment. And now we've identified it. Now, what are we looking at? How are we mitigating it? How are we working around those issues?
Yeah, we can't enforce student vaccinations. We know that.
I appreciate that. Yeah.
The only way to mitigate that with our students is, again, the masks, the physical distancing, the hand hygiene,
Yeah.
the cohorting, all of those things.
Yeah, but I mean, if we're doing the full risk assessment, though, that we're going to go back to the public and say, we're doing the vaccination because of this risk assessment, that needs to be included in there so that the public sees we're doing a full risk of the whole work site.
Yeah, good point. We'll include it.
I should tell you that in those same age groups, 12 to 19, in both Rocky Mountain House and Drayton Valley, I don't have the exact figures in front of me, but it's significantly higher. One dose vaccination rate for 12 to 19 in both communities is above 50%, but not much. So it shows a willingness to get the vaccine is in the majority, but perhaps the ability to get both vaccines is a barrier.
Russ, and I don't know, but perhaps because of the vaccination program in our schools, it did give opportunities for some students that otherwise weren't able to, and they probably would have only gotten their first vaccine dose here in the fall, and the second one would be, coming at a later date. So that could be part of that as well.
Yeah, and so that's part of the hazard assessment too, is the willingness to be vaccinated, to at least get one shot and perhaps two. I guess it's my turn now. Emma, are you there? I'd like to ask if you have any more details or are able to inform us a little bit about the ramifications on insurance. You know better than any of us the trials we've gone through finding providers that are affordable. And maybe I'll go on to my next question since Emma's unavailable.
I'm here.
Nope, she's there, Russ.
Oh, here's Emma. Did you get my question, Emma?
I did get your question. I don't have a specific answer to your question. It's just in early discussions with Marsh, our insurance provider, but it is something that they are talking about.
Okay. Does it involve increased costs?
Potentially, yes, but it's still in its infancy, so we don't know for sure. But yes, it is a discussion that's being had right now.
It is another factor that we're in control of that could affect our insurance, what decision we make, which side of the fence we fall on this proof of vaccination mandate. Is that a factor that?
Yeah.
That hasn't necessarily been said, but I can probably assume that might be a case with depending where we fall could affect our premiums for sure.
Okay. Okay. Well, we await more information on that. I think that's a crucial factor. During the height of a pandemic, it would be nice to have secure insurance. Another question. The collective agreement survey with our employee groups is not completed. We all know that collective agreements in the past, not the recent past, but in the past, have been a generator of grievances, usually over interpretation of words or clauses in those agreements. So we know how important it is to have that information before we move forward. Even then, our interpretation of clauses and words may not be how the employee group sees them. I see some real dangers there, is that we make an assumption about a clause means something that is within an AP or a policy, and yet our employee group sees it as being outside. Do we have a process of reconciliation? I know that would take a long time, but how do we make a policy when we're just guessing? Or if we did make a policy, how would we know rather than just guessing about whether we're in compliance with collective agreements that in the past have been the source of disputes and grievances?
Well, Russ, it's like anything with, like you say, collective agreements. We're going to have our human resources department go through our collective agreements and try to anticipate if a vaccine procedure or policy would create grievances. We've had kind of some assurances from our unions that they're mostly in agreement with a policy, but then they've got their butts, like make sure that you there's no disciplinary measures and some of those things. So, for those that can't be vaccinated, which, I mean, obviously we're not wanting to have discipline as part of this. We're just, that's not the focus at all. But I don't know what else to say, Russ, except that we will have to take our interpretation of it the best we can and either move forward or not move forward based on what we discover when we look at our collective agreements.
Yeah, one of our employee groups starts the first sentence of their statement with, we'll review and seek legal advice on any policy implemented by the division.
Yeah.
Any actions taken by the division against employees pursuant to a policy, et cetera, et cetera. So I guess they're putting us on notice.
But then underneath that, they list the things that are acceptable to them, I would say, right?
Yeah. Oh, yeah. Doesn't.
Yeah.
I wish we could find a cooperative way, a more cooperative way to do this.
Gary had his hand up.
Gary, those are my two questions. Go ahead, Gary.
No, that's okay. I asked my wife and I got my answer. So I don't have a question right now.
Okay, well, do trustees, I thank you, Brad. You've been on the hot seat here for an hour or more now. And I guess we're doing our job when we're asking hard questions. And it must be frustrating that at this point, you don't have all the answers. I guess none of us do. I used to tell my classes when I was in the classroom that your ability to ask questions is far beyond my ability to answer them all sometime. And you probably feel like that now. But we do have some more time. As long as we get to the hockey game by the third period, maybe that will be in time. But and I'm sure you're willing to take some more questions. And I see Daryl has got his hand up. Okay,
Sorry to bother you again.
Daryl.
Sorry to bother again,
No,
but
it's good. We're doing our job, sir.
Brad, or maybe Brad and Russ. Okay, and this is just about procedure right now, about where we're going. So we're making a decision to either make this AP or a policy. But if we make that decision, then have we made the decision that we are going to mandate? Because if we're going to mandate, then we want the AP or the policy. Or if we're not going to mandate, it doesn't matter. Or are we just looking to send it to, is this an AP or a policy to get more information to see what direction is best to go and how to handle it before we make the final decision? I'm just kind of looking for a little, where are we going?
Well, I can't answer that. That'll be the board's to decide. But if you remember, I said your options are three. You can choose to not make a policy or an AP and just leave things as they are. That would be a decision. You could choose to make a mandate that is an AP, or you could choose to make a mandate that's a policy. I don't believe that the board was ready to make that decision tonight. That was the impression I was given going into this meeting. And so we actually turned away 2 delegations because those delegations want to have an opportunity to influence the board. They don't, if the decision's made already, then those delegations are pointless.
But that's part of my question. How I feel uncomfortable to make a decision tonight. How do we as a board direct you and admin to gather more information to make a decision? Are you gathering information for us to make a decision on a policy? Are you gathering information for us to make a decision? I mean, AP is not in our sandbox, but I feel we as a board need to be part of this process. And I feel like, especially on the lawyer issue, the insurance issue, for the opinions, I think there needs to be more information gathered. So how do we as a board direct you to gather more information, come back to us so that a decision can be made about, are we mandating or not?
Yeah. The board does that all the time. When you think of our regular board meetings, often be asked, can you at the next meeting, bring back information on this, or there's questions. So I don't believe that you need to have a motion tonight or a vote on anything. I think, the board could simply say, hey, we need more information. I've been listing the questions that you've been giving me. We know there's some things on insurance we want to look into. The board could send further questions as you think about them tonight, as you, as you're, thinking over the next few days, you can send me further questions. And I think what we do is the board would then say, we're going to talk about this topic next on such and such a date. And we're asking our superintendent to answer the questions we've given tonight. And maybe at that meeting, then we would bring the delegations who want to speak to it so that they can add to that conversation. This was really just an introductory meeting just to get the ball rolling. So that would be my advice.
Thank you.
Brad, I very much appreciate your initiative on the hazard assessment. And I very much want it to be completed. I think it's valuable information that the board needs to take any next steps. But I know that'll take time. Julie, go ahead.
Yeah, you know what? I really believe that because we didn't know that we had 2 delegations that have asked to speak. And I think it would be, I don't think it would be right for the board to make any decision before they have an opportunity to provide their input, both sides. Because I didn't know that we had, 2 different groups that wanted to speak. We should let them provide their presentations. It would only be fair.
That would also be my recommendation.
Yeah. That's a consequence of the pace of events. And I apologize, Julie, for not distributing that information. It wasn't confirmed as I understood, but I apologize.
Yeah, you're right,
Yeah,
Russ.
well, that's fine.
This is moving pretty fast, right? Like we were in conversations as to whether those would even happen, and so things are happening quickly. And I think the board realizes that there's not a lot of, we haven't heard of any rural boards yet that have come out and made a statement on this. We're all kind of in the same boat, looking into it, talking to our legal advice, talking to each other, putting out surveys to our staff. That's the discussions I've been having with my peers in Zone 4 and those other rural school divisions around us. So I don't think the board should feel bad about taking the proper amount of time to make a good decision.
Yeah, Edmonton Public has lawyers that they can walk down the hall and talk to. We don't. They have a far bigger shop than we do. We have hardworking Greg Redmond and very hardworking Brad Volkman and hardworking Emma Urbinski, and that's our senior admin, and others, of course. But so I guess they can do things quickly. We need to take our time, and I hope that people watching this stream today appreciate the fact that we're a thoughtful group who are concerned about our children and our staff and trying to make good decisions. And sometimes that takes time.
And Russ, something that Julie mentioned is we're rural, and we've only seen urban examples right now of completed, and even with Edmonton Public, I can't find the actual policy, the actual wording. I could find their news release. I can't find the details. It's not listed anywhere on their website. So there's still a lot of stuff happening in the background that hasn't been fully made public yet.
Yeah, there seem to be 2 approaches. Divisions whose boards come out early and ask their admin to fill in the blanks, do the details and the specifics. And some boards like Edmonton Public who have it all worked out, or Edmonton Catholic who have a 6-page policy covering just about everything, ready to go. We're not them.
So that's actually an admin procedure for Edmonton Catholic.
Oh, you're right. I'm sorry.
Yeah.
Admin procedure.
Yeah. So I guess my question is, by when would the board like me to make the next presentation to answer some of these questions and kind of get a little more of this information? We know we have a public board meeting on October 26th, and that's what else makes this a little tricky. We're in transition, as you know. We'll be swearing in the new board on October 25th, sorry, on October 26th at our organizational meeting, and that'll be followed by their first public meeting. We've got a fair bit on that agenda already in terms of our AERR and our ed plan and so on. Maybe this is something where we want to make a date, a specific special meeting date just for this topic, because we're going to bring in those people that would like to be delegations to the board. But I guess I just need to know when we'd like to do that.
That's a good question for the board. Let's
If
find
I'm-
out what
if
the
I'm-
board's thinking. Mr. Scott?
Well, a couple things. I agree totally with what Brad's saying. I suggest that October 26th is already over full. This is going to take most of the day. For me, I'd like to see it at the October 26th meeting, a special meeting date be set there. And because I think this is going to take most of the day when you have delegations coming in. But I personally,
Wait,
if we
Daryl,
could,
I just clarify there?
sorry.
Sorry, you broke up.
Okay.
I thought I heard you say that a date would be set for the special meeting at the October 6th board meeting?
26 board meeting. 2/6.
Right, and then a date would, 2/6,
Set
and then a
that-
date would be set then? Okay. Good.
Down
Sorry,
the road.
Just point of clarification.
No problem. But because this board has so much knowledge, it's been ongoing for quite a period of time. I'd like to see this board spend a couple extra dollars and have just a governance and priority meeting with this board, with the 3 new elected people, to bring everybody up to speed to move forward. And probably I'm suggesting that 21st of October for that meeting, but that's an extra meeting, an extra expense. But I think it'd be very valuable expense for those departing, passing on the information to those coming in.
Brad, does that, I'm
Yeah.
not seeing any objections or approvals, but just for the sake of brevity, is the 20th enough time for you to gather this
Yeah.
information?
Well, but I think what I'm hearing
No.
Daryl say is I won't necessarily need all the new information by the 20th. It'll be to
Okay.
kind of a passing of the baton between the old board and the new board, basically getting them up to date where you're at right now. Then on the
But-
26th, the new board will decide what date they want me to present the next information.
But also, Brad, with the new people sitting there, they may have different questions than we do that require,
right.
They may want you to get some other or different kind of information. So I think it's important, definitely for you to be there, but also the opportunity for time for you to get information that they might be able to ask.
Absolutely. I think that's a good choice.
I'm looking at faces to see if we have a consensus or not, if we have a plan. Tell me the procedure for calling a G&P, a governance and priorities meeting.
So all of
I
the
know-
trustees are here right now, and so you can just make the decision. It's not a public meeting, so you can just agree that we're going to meet on the 20th at 9:30. Then, of course, we need to make sure that the new trustees are available. So Dawn will reach out to them first thing tomorrow morning, and
21st, one's already reached out. 21st would have to be.
okay,
Does 21st work?
we can make it work.
Gary Thompson, go ahead.
First doesn't work for me at all.
So we've got a trustee saying no to the 21st. How's the 20th for you, Gary?
Yeah,
I'm sorry, I didn't hear. Is it a go for the 20?
the 20th is the goal, yes.
Okay.
Mhm.
Well, how's everyone else's availability? I'm available on the 20th.
Yeah.
And the 21st.
Not the 21st.
Julie, how about you?
I
May's
will
saying
do
not
my
the
best.
21st.
Yeah, I'll do my best for the
Say again?
20.
Okay.
I will be flexible.
Thank you, Heidi.
So which date are we deciding on? Are we deciding the 20th?
We're deciding on the 20th.
At what time?
Gary Kendrick. Our usual time of 9:30. Does that work for you, Brad?
Yes, it does.
Anyone else 9:30 not work for? I'm not hearing anything or seeing anything.
So-
Okay, go ahead, May.
So this will be a virtual meeting?
Yes.
Okay.
What if the
So,
other three
unless-
new, what if the other three new trustees that are going to be sworn in can't make it though?
Uh,
I have
well,
a confirmed, I have a confirmed yes on one.
Okay.
So Don will reach out to them in the morning and we'll cross that bridge when the time comes. I don't know if we have an alternate date that might work. Or perhaps maybe if the 20th in the morning doesn't work, maybe the afternoon would work, but we'll reach out to them.
Okay.
Okay.
I think that's the best we can do tonight.
Yeah, I think so too.
We have a GNP on the 20th at 9:30. Hopefully some of the elected, well, we'll work with what we have, I guess. And at the board meeting of the 26th, after the new board's sworn in, they can take Daryl's advice and call a special meeting where the superintendent will share the completed or partially completed hazard assessment. And then the new board will take it from there.
Mhm.
Any last words before I ask for adjournment? Seeing no hands. Thank you, trustees, especially thank you, Mr. Volkman. We put you on the hot seat and you survived. Well done. And thank you to trustees for asking important questions that we'll need. And thank you for your complete answers where you could. And we look forward to answers to the questions that we're not yet able to answer. Thank you to Emma and Greg for attending. And thank you to the IT staff that made the streaming possible. Remember that our monthly regular meetings are also streamed. That's my understanding, Greg, on YouTube. As I think all our public meetings will be streamed. So if I could ask for adjournment, please.
Yeah, just before you go,
Motion.
just before you go,
Go ahead, Darryl.
I just think we need to say thank you to the lady who keeps us under control. Thank you, Dawn. Appreciate your effort.
Oh, and Dawn, thanks for giving up your evening. Could I have a motion to adjourn, please?
I adjourn the meeting.
Thank you, May. There's a motion to adjourn. All those in favor? I'm not seeing Gary's frozen and Julie, Heidi's there.
We,
Julie, how are you
everyone,
voting?
was up.
Okay. Then we are adjourned.
Good night, everyone.
Good night.
Good night.